subject for today is about cryptococcosis. We are dealing with this as a part of the requirement of third class mycology course, which is the TBL courses. The objective of this study is to suspect and early diagnose yeast infection in human. One of these dangerous yeast infection caused by Cryptococcus neoformans and Cryptococcus gatti, which are responsible for a disease called cryptococcosis, which is usually acquired from exposure to a dropping of certain type of birds like chicken and pigeon. Second, we have to make use of all the feasible laboratory tests which are essential to reach to our definite diagnosis as early as possible in order to maintain the life of the patient because they are very serious diseases. The third purpose of this objective is to design a way and the time needed for the treatment. Since it is a serious disease, we should keep in mind that we diagnose early in order to treat early and to reach to a definite diagnosis in the appropriate time before deterioration of general condition of the patient occur and the treatment will be of no use. We have first case scenario number 1. A 45 years old engineer male patient presented to our unit as a person who is complaining of headache, vomiting, a blurred vision, and he was admitted to the emergency unit, medical emergency unit, with a history of gardening, and he was a very healthy personnel before the onset of this illness, and he was very active, and he has no other medical condition. The only complaint that he was dealing with organic fertilizer to grow roses, and he is starting to develop headache followed by vomiting, blurring of vision, confusion, and sometimes attack of loss of consciousness. After examination of this patient, he was afebrile, severely dehydrated, with a heart rate of 120. His blood pressure was normal, 120/70. During his examination, we noticed that his neurological examination was abnormal. He showed a neck stiffness. He showed papilledema on examination of the pupil of the eye by special fundoscopical examination, and he was having a blurred vision. His vision was not well clear, with poor concentration and on and off attack of disorientation, and sometimes they describe that he lost consciousness at home. We should ask ourselves, what is the possible diagnosis achieved from exposure to such a condition, and why you diagnose such a case? Second, we should name two causative agents which might cause this disease, and we should give two drugs for the treatment of this condition. We diagnose by our appropriate way. The third question, if the yeast is the cause of this disease, we should name four ways to prove the diagnosis of cryptococcosis. And the fourth question to be applied to our session today is, what are the findings in the lumbar puncture in each case we are suggesting? The possible diagnosis of this case is the major cause of fungal neurological condition, which is meningitis, and the most common cause is by Cryptococcus neoformis. So this is a case of a cryptococcal meningitis or meningoencephalitis. This is the diagnosis. Why we take this diagnosis? Because we are looking for the cause of the condition, which is associated with a lack of fever. The important thing in viral meningitis or bacterial meningitis to have very high spiky fever, as well as the patient might develop a symptom much more rapidly and with some super added condition. In this condition, the patient was afebrile. His CSF finding was suggestive of that of fungal meningitis, and the most common cause in this case is the cryptococcal meningoencephalitis or cryptococcal meningitis. If we could name a three causative agent of meningitis, we could have viral meningitis, bacterial meningitis, and fungal meningitis. Sometimes we might have also intoxication, such as massive exposure to certain lead poisoning, might end up in development of toxic meningitis. Also, each drug administered in each condition, in case of viral meningitis, if it is caused by DNA viruses, we can apply a cyclovir drug to be administered intravenously. In case of bacterial meningitis, the lumbar puncture should be exposed to culture and sensitivity to know the causative agent and the appropriate antibiotic to be applied. So after aspiration of lumbar puncture, we can give the patient a broad spectrum antibiotic and wait for the result of the lab to change the type of antibiotic. We should not leave the patient without antibiotic after getting the sample, because he might deteriorate rapidly. It could be caused by gram-positive bacteria or gram-negative bacteria accordingly. If the yeast are the cause, name for laboratory way to prove the diagnosis. Diagnosis of fungal infection, the same laboratory procedure will be followed. First, we can take the specimen, we do centrifuge, and we do a negative stain to notice the presence of capsulated cryptococci within the CSF. Also, you could do a biochemical analysis for the lumbar puncture to prove the diagnosis. The next step will be done by the culture of this sterile lumbar puncture specimen in appropriate media like brain heart infusion media on a blood agar, corn meat agar, etc., which will all encourage the growth of cryptococci as well as gram-positive or gram-negative bacteria. But the viruses could not be cultured, we all know this fact. And these specimens are kept within the incubator during first 24 hours. Some of the colonies will start to be noticed, and we can take slide from them and stain with the gram stain to be noticed under the microscope, give us idea about the causative agent, which could be bacterial or fungal. The third step, if it is a yeast, you can do EPI test, which is a biochemical test, EPI20 candida test, to prove the type of candida responsible for, or the crypto or any other type of yeast could be responsible for the development of this condition. And in case of cryptococcosis, urease test will be best for the initial diagnosis of a crypto from all other yeasts, which are all urease negative, while cryptococcus are urease positive. And the fourth step afterward, we can do Vitic test in order to obtain the appropriate antifungal susceptibility of this yeast in order to design the appropriate treatment. PCR could be done, immunofluorescent staining for the CSF, anticryptococcal immunofluorescent stain could be done as well for the CSF sample. The fourth question to be answered, what are the findings to be seen inside the lumbar puncture, which is taken from the under the second lumbar vertebrae, and you introduce a special type of cannula to obtain the CSF. It should be a normal patient, good under good pressure and fluent and clear. But if it is turbid or bloody, or sometimes it is hard to be obtained because of its thickening. In case of TB, it will be very thick because of presence of a large number of thick purulent discharge. So the first view of this CSF will give us an idea about the cause. If it is clear, it could be viral or fungal. And afterward, we can look for the presence of the number of white BC. If there is an excess of lymphocyte, we can suggest that it could be fungal or viral, and the number of leukocyte as well will give us idea it could be purulent and bacterial. If there is increase in the sugar, reduction in the protein, it favors the bacterial meningitis. If it is about not that increase in the sugar but elevation in the protein, it could suggest fungal meningitis. So sometimes we can view a large number of cryptococci within the CSF, which is a rounded structure and with a central dimple in the center, and sometimes with budding. This is highly suggestive for having some yeasty type of meningitis. Fair enough for the first case. We can move to another case. A 35 years patient presented to our unit as having a history of being a mycology lab worker. So she works in the mycology lab, presented to the dermatology department with a history of 3 weeks non-healing papule over her hand. This papule was not responding to local and systemic antibiotic given to the patient, and the patient having a history of asthma, that is to say having attacks of shortness of breath, difficulty in breathing because of allergic bronchitis. She was on high dose of continuous steroids intake in form of inhaler as well as oral tablet administration of prednisolone. On examination of such a patient, her pulse rate was 120, blood pressure was a little bit high because of maybe continuous steroid intake because she's young in age. It was 140 over 90. The papule on examination was non-painful, rounded, and having central ulceration with a little hemorrhage or hemorrhagic discharge from the center of the lesion. The lesion looks like a tire with elevated edges and a dimple inside the center with a hemorrhage from the center of the lesion. This is a picture of a lesion we are talking about, an elevated entire edge with a circular lesion and central depression with a crustacean or hemorrhage from the center. Usually it have been extended for about more than 3 weeks. The 3 questions to be asked for this case scenario is we have to give 3 possible infective microorganisms responsible for causing this condition or a similar condition with a similar clinical picture, and the answer for that will be a different type of skin infective disease. For example, if we start with the fungal cryptococcal lesion, and this should be associated with some element of suppressed immune system. In this condition we have excess steroid intake for a longer period of time, or the patient could have leukemia or lymphoma, or patient with solid organ cancer on massive doses of chemotherapy. Those are possible causes. The second, another infective microorganism could be responsible for initiating such an illness. We could have a viral lesion, ulcerative viral lesion. For example, we might have shingles, but it will be in a different way because they will be a larger in number with a different vesicles and severe pain at the site of the area, and sometimes the patient will be immunologically intact. He has no any other possible cause to have his immunity suppressed. Also, another lesion, we could have another lesion, for example, multiple abscesses caused by gram-positive cocci. We could have a staphylococcal skin abscesses. We could have also cigarette burning with the super added bacterial infection accordingly. The second question to be answered is 6 causes of immunosuppression status responsible for initiating fungal infection. We could mention the steroid therapy, prolonged steroid therapy. This is one. Blood malignancies like leukemia, lymphoid tumor like lymphoma. Also another immunosuppressive condition associated with intensive chemotherapy for solid tumor or blood cancers, as well as the administration of immunosuppressive drug for organ transplant like renal transplant or liver transplant. Some other condition like a prolonged administration to the unit of RCU, cause immune suppression. Also massive surgical operation like open heart surgeries. Also we can have autoimmune diseases treated with steroid, and sometimes steroid with chemotherapy like rheumatoid arthritis, etc. So those are common suppressive condition where we suspect to have exposure to fungal infection like this cryptococcal skin lesion. The third question to be answered: is this situation treatable? Yes. If we apply appropriate treatment in appropriate time, if we try to improve the immunosuppressive status, you can get some improvement and healing on those conditions. If we, for example, in case of our patient, we taper the steroid and we replace the type of treatment for the asthma, the patient might have some improvement. With the application of topical antifungal and systemic antifungal drugs, we might achieve complete recovery in a good period of time, since the patient is not having any cancer or not kept on intensive chemotherapy or radiotherapy. Most of patients who are having cryptococcal infection will recover spontaneously if they have intact immune system within less than 1 week, with or without treatment. The fourth question: name, lab diagnosis, and local and systemic treatment could be applied in this condition. The laboratory diagnosis depends on the swab of the lesion, and then we disperse it on slide. We stain it with a gram stain. We look for the presence of a special type of yeast, which are rounded with central depression and multiple budding. Second, the same swab could be cultured on appropriate culture media for 24 hours, looking for the circular dull color colonies of cryptococci, which are non-hemolytic, grown on a blood agar or a brain heart infusion agar. And once we take a colony, mix it with India ink, we look for the negative stain. It will be positive for Cryptococcus neoformans. Third is to obtain a pure culture, and then we should do a EP20 test to do biochemical testing for the cryptococcus. This will give us idea about the actual type, whether it is a cryptococcus neoformis or a cryptococcus gati, which are the dry type, while cryptococcus neoformis colony are more wet and mucoid. And the third test to be done, we could do a Vitek test in order to obtain appropriate antifungal drug map to start treatment. This condition is treatable if we apply the appropriate drug administration. If it is a small lesion, we can apply topical, but mostly we should treat the initial cause of immune suppression first, and second we should apply a drug like amphotericin B liposomal form or lipid soluble form, which are the best type of amphotericin, better than all the traditional one with the large number of side effects. Also voriconazole, a drug, could be applied in such condition, and 5-fluocytosine, if combined with amphotericin B, will give us very good result within the first week. Thank you for your attention, and I think this subject will be more clear if you review your theoretical lecture about Cryptococcus neoformans. Just remember that a disease which is diagnosed early could be treated early, and you will get very good result when you correct the immune condition or immunosuppression status of the patient.